All right, 8:35. Good morning. Time for your TTO program. This morning we have Allie in from West River Health Services. Good morning, Allie.
Good morning.
How are you this morning?
Pretty good.
Yeah, it's a Wednesday,
Yes.
and
yes.
we are not well. We were supposed to do it last week, right? Something
think
come up
so.
last week that. Who
Yes,
knows?
I was at the North Dakota Healthcare
Oh,
Task
there you go.
Force in
There you
Bismarck.
go. All right, so we moved it a week, which is okay.
Yes.
Today is 9/11. For those that don't realize it on the calendar. But yeah, today is 9/11, and we are talking West River Health Services, and a few things to talk about this morning, and I know I'll let you start on what you want to start with, but also we'll throw some other stuff in there as well. So
Perfect.
go
Yeah.
right ahead.
And you actually reminded me. I will give a little debrief on my participation with the North Dakota Healthcare Task Force. So they set out to recruit, per se, hospital representatives across the state, two of which being critical access hospitals in a rural area, which West River Health Services does fall into. So they have asked me to join. I believe it was one of our senators in the region. So they asked me to join, and we're really digging into the cost of healthcare within the state and what can we do as a state government to really help decrease the cost or the cost curve as it comes to healthcare. So we have a big focus right now on increasing preventative wellness. So those are your annual wellness visits or your children getting vaccines and cancer screenings and such. A big focus on collaborative quality, so creating a state situated committee around quality and defining that. And right now, depending on what insurance you have, we try to meet all of the quality metrics of these different insurance companies. But from Blue Cross to Medicare, they want us to track and measure different quality measures. So there's going to be a push from the state to hopefully get everybody on the same page, which would really ease our physicians and providers to be able to work towards those goals a bit more and less backleg work for meeting 10 different metrics and really focusing on 5 would be, I think, a bit easier just for the administrative process of those. So I'm excited to see where this goes. We have another meeting in October, and then they'll be formally presenting to the healthcare committee. So then
Okay.
we're jumping right into legislation. So
There you go. Yeah, yeah, definitely.
we'll see if all this work for the last year has panned out.
Yeah, there you go. Okay.
But yeah, so you would think school started, kids are getting settled in, but I feel like things keep rolling along. So I have a list of several of the things going on with us either this month or next. One big thing is in September this month, on the 16th and the 26th, our behavioral health providers, so Jackie Hedstrom and Tara Jorgensen, along with Hettinger Public Schools and the Southwest District Health Unit, are doing 2 sessions on education for cyber safety and security. So I think that'll be a great opportunity. So on September 16th, they're doing that at the school for the kids. And then on the 26th, that is a public meeting, and it's being held during parent-teacher conferences.
Okay.
So we should all have some time to be able to pop in and
Yep.
get some good information. So that's a great time to have those scheduled. So excited to see that. And then flu shots. I hope nobody's gotten sick yet.
Yeah, it is that time of year. Yes.
We're getting close, right? I think it's October is kind of the general date for this area. So you can always get your flu shot at any of our locations when we're open by scheduling an appointment or if you already have an appointment scheduled. But we are offering several flu clinics or drive-up flu shots in October, and so you can always call and ask the clinic that you utilize when those are, or I know Cindy has them posted on our Facebook page as an event, so figure out which one works for you. If you'd rather just pop by in your car and not have to get out, great, or if you'd rather just tack it on to a visit that you have, we can do that as well. Definitely want to make sure you get that because you do not want the flu and neither do I.
No. And it's usually, I wouldn't say the later you get it, the better, but it all depends, I suppose, when the flu starts to hit. So
Yep.
kinda,
So we're starting those in October.
yeah.
Yeah.
So, and I know they're going to be giving them at the Farm and Home Show
Yes.
on the 25th. So that's later in the month. So if if you're like me, put it off, and then you come to the Farm and Home Show, it's like, voila, here it is, flu shot.
Right.
So yeah, your chance to get it is going to be numerous times from West River. So
Absolutely.
which is nice.
And then another fun event that I will be in attendance to, absolutely, is our eyewear extravaganza with our West River Eye Center. They have our reps for our glasses. They're coming and doing a big showcase of all of our eyewear at the Kokomo Inn in Lemon on the 26th as well. And
Of September here.
Yes,
Yep.
of September. So that's from noon to 4. And so I am excited myself to go pick out a new pair of glasses and figure out what looks best on me. So if you're in need as well, this is a great time. I know too, Molly might get mad at me. I don't know exactly the percentage off, but there is a sale that occurs with this too. So if you want one or two and you're a bit of a shopper like me, it's a great time to go and pick something out.
There you go. Yep. Okay.
And then lastly, I hope everybody's been getting, we call them care messages. It's very likely that you should have been receiving either a text message or a phone call from a North Dakota number. And it's either providing you with a voicemail or a text or just a
The first text
verbal.
will freak you out.
Yeah.
You'll think it's like, what is this? Because I got one from the other day. I got one and I'm like, how did they know I was going to go see that person? And I'm like, should I click it? I clicked it, and it came up. It was a little chat that says, looking forward to your visit, blah, 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 any questions? So, which was kind of nice to be able to have that contact with your doctor.
It is, yes. So, just a few things. We are still working out some kinks in that. One was it was set up on Central Time and not Mountain Time. So if you got a text message or a call pretty early in the morning, we apologize. So we're still working on those. I know one thing is if you are still receiving, we tried to shift everything to text messages. But if you're getting calls on your cell phone and you'd rather have a text message, just reach out to the front desk there at the hospital, and they can get that updated for you. There is an update with this program too that hopefully later in the month it should be updated and we can put our own caller ID on there.
Oh, okay.
So
that'll be good.
Then it shouldn't give you too many scares.
Yeah, exactly.
Yep. And so right now we are just doing the appointment reminders, but this is really a robust platform, and so we'll be able to run reports. One thing I've utilized it in the past. One thing that I appreciate as a busy mom is I get a text message and it says, your kid is due for vaccines. Get in here.
Yes.
It doesn't say that, but
pretty close.
It's a pretty nice reminder to go, oh, okay. Otherwise, I kind of just juggle and try to catch up. So it's great for those keeping you on track yourself, and we'll be doing just some campaigns through it as well. So it's a great resource to have that capability.
All right, super. Yeah, it's going to be nice. Another feature for West River Health Services. So. All right,
Yes.
Anything on the recruitment side? Any new doctors coming or anything?
Well, that's what I walked in today and Nolan said, oh, it's just you today? And I said, yes. We had recruited a physician that was completing a chief residency year in Rapid City who does family medicine, OB, and he was supposed to be joining us here this week or next. So we were really quite excited. But unfortunately, this is one of the good news and bad news. He called me about 2 weeks ago and said, I got accepted into a fellowship at Grand Forks to do a fellowship in obstetrics. So he will be at that fellowship for a year, and when he's completed that, he'll be able to do C-sections at our facility. And so, in speaking with him, he has the full intent to return to West River Health Services in a year, because that's how long the fellowship is. I'm pretty sure I need to follow up with him. His wife might be in town. They already had their apartment settled and everything.
Oh, jeez. Oh, there you go.
Yeah, so now they're kind of, last I knew, they were trying to figure out if they were going to jump back and forth between Hettinger and Grand Forks, or if they were going to kind of just shift to Grand Forks for now. And there's also potential, too, that later in that fellowship program, he might be able to have some free weeks to come and join us and open up a bit of a practice, whether it's just coverage in the ED and inpatient side. So when we get his new schedule, we will get that stamped and approved and put out like crazy, but we're really excited to have him on board, even if it is a year later than we were hoping for.
Definitely. Always good news when you're
Yes.
bringing in a new doctor. So, all right. Anything else this morning?
That's it. I hope you have a great week.
You too, and we'll talk to you in October.
Perfect. Thank you.
And the weather will be a little bit cooler by then, I think.
It will.
Yeah. All right. Have a great day. Thanks, Allie. All right, Allie from West River Health Services.